Hi, I'm Dr. Aman Gupta. I'm a urologist and kidney transplant surgeon at Fortis Hospital, New Delhi, India. Today we are going to discuss about an operation which is called as partial nephrectomy. What is partial nephrectomy? Nephrectomy is the word used for a surgical procedure where kidney is removed surgically by a urosurgeon. What is partial nephrectomy? Partial nephrectomy means removing only a portion of kidney. Now, when is partial nephrectomy done? Whenever there is a cancer of the kidney, if only the cancer of that area is removed, leaving some portion of functioning kidney behind, it is called as partial nephrectomy. There are two kidneys. There are people who are diagnosed with a small cancer of the kidney. Then what a surgeon or urologist does is that he or she removes that cancer along with some portion of the kidney to cure the cancer, leaving some portion of kidney behind which can function normally and preserve the function of the body. How is kidney cancer diagnosed? What are the symptoms and what is the treatment? Most commonly, the kidney cancers are diagnosed during an ultrasound which is done for a different purpose. For example, somebody comes for an annual health checkup. He or she gets an ultrasound done. He or she may not have any symptoms related to anything. However, the ultrasound shows that there is some tumor or growth inside the kidney. We confirm that using a contrast CT scan, which by and large will confirm whether you have a cancer or not. The CT scan will give a confirmation along with the size of cancer and also show if the tumor has gone outside the kidney or not. Very rarely we may need to do a biopsy if there is any confusion. Once the kidney cancer is diagnosed, we have to stage it. Staging is done by ascertaining the size of that cancer, and by doing a PET scan we have to see if the cancer has gone outside the kidney into other organs like adrenal or the lungs or liver or bones. If the kidney cancer is small, especially if less than 4 centimeter, then we can just remove the cancer along with very minimal portion of the kidney and leave rest of the kidney behind with the person. The advantage of partial nephrectomy is that somebody whose kidney function is already compromised, suppose a person is diabetic for many years, he or she has a risk of developing some kind of kidney ailment in the future. So if we can preserve the kidney to some extent, that would be desirable. However, it is generally possible in smaller tumors which are less than 4 centimeter. Very rarely in tumors which are larger than 4 centimeter, we can do a partial nephrectomy as well. How is partial nephrectomy done? It can be done by 3 methods: robotic surgery, laparoscopic surgery, or open method. Robotic surgery and laparoscopic surgeries are preferable because it involves minimum cutting, the bleeding risk is low, there is faster recovery, and person can return early to his or her work. Open surgery also gives good results as far as the cancer outcomes are concerned. However, there is a bigger cut on the body and recovery to return to work is maybe delayed. However, as far as the cancer cure is concerned, all the modalities are equally good. For the partial nephrectomy, a person generally has to stay in the hospital for 4 to 5 days, and the complete recovery takes almost a month. He or she will require to undergo regular follow-ups every 3 months to see the functioning of the remaining kidney or to see any chances of recurrent tumor. What are the preventions for kidney cancer? Number one, as I mentioned, that most of such cancers are picked up and at an early stage by an ultrasound. So if it is possible in your country, one must undergo an annual health checkup including an ultrasound of the kidneys. If you have any growth detected in the kidney, you must see a urologist urgently. The symptoms of an advanced kidney cancers can be pain in the tummy. Somebody may feel a lump in the tummy. People may have unexplained weight loss, prolonged unexplained fever, or prolonged cough or pain in the bones because of the spread in the lungs or bones. So the best chances of cure are when the kidney cancer is diagnosed at an early stage, and that is the only time when partial nephrectomy is possible, because if the cancer has grown above 4 centimeter, then there are chances that the complete kidney may need to be removed. So one must be careful that one should go for annual health checkup and see your urologist at the earliest. Thank you so much.